My name is Nik Bakti. I'm one of the orthopaedic consultants here at the One Ashford, and my special interest is in upper limb surgery, in particular shoulders and elbows. So frozen shoulder, or is also commonly known as adhesive capsulitis, is a very painful shoulder condition. It's also quite common. It is when the shoulder is stiff and painful, and it's due to the lining around the shoulder, which is normally flexible, soft, supple, becomes swollen and inflamed, therefore the pain, and in the long run it becomes scarred and tight, and that gives you the stiffness that's associated with the problem. It's something that we as a medical profession don't really understand as to why it happens, but we know that there are several types of patients that are more at risk of developing frozen shoulder. And this includes patients who are diabetic, patients who suffer from thyroid diseases, heart diseases, and high cholesterol levels. It is also more common in females, and in the age group of 40 to 55, they're more prone to developing frozen shoulder. It often comes on out of the blue, spontaneously. So you wake up one day with a painful shoulder that becomes stiff. But it also can develop after a very trivial injury. So again, out of the blue. But it can also develop as a complication following shoulder surgery. The symptoms of frozen shoulder is excruciating shoulder pain. It's thought to be one of the more painful shoulder conditions. But as the problem progresses, the shoulder becomes stiff. So there are three main phases in frozen shoulder. The initial phase is known as the freezing stage, is characterized by sudden onset shoulder pain. This is when the lining of the shoulder becomes inflamed and swollen. This can last anything between 2 to 4 months. Then you move on to the frozen stage, where the pain is still a problem, as many patients report, but the shoulder then progressively becomes stiff. This is when the lining becomes scarred and tight. And again, this phase can last for about 4-6 months before moving on to the next stage. The last stage in frozen shoulder is known as the thawing phase. This is when pain is not so much of an issue, but the stiffness becomes a problem. This phase can last up to 24 months, so it can be quite frustrating to patients. So the mainstay of treatment of frozen shoulder is stretching with physiotherapy, but it can be quite difficult in the early stages because of the pain. So on top of physiotherapy, pain management is quite important to allow you to do your stretching. Most of the time, over-the-counter strong tablet painkillers is sufficient, but if it's not, then an injection to the shoulder under X-ray or ultrasound guidance can be done to help you get on top of the pain. And 90% of patients with frozen shoulder manage the shoulder problem with physiotherapy and painkillers. If after a period of trial of physiotherapy and painkillers, the stiffness, the pain continues to be a problem, then surgery is an option. There are two options when it comes to surgery or more invasive procedures. And the first is a manipulation under anesthesia. So this is when we get the patient to go under general anesthetic, and then we manipulate the shoulder, putting a constant force on the shoulder to help break down this scarred and tight capsule or lining around the shoulder. Sometimes this is not enough, then you may have to have a keyhole operation to your shoulder, where we use tools to help break down this tight capsule and to help the shoulder move better. And often these two procedures, the manipulation and the capsular release, is done hand in hand at the same time. But this is very rare. Like I said earlier, most patients recover without having to go under general anesthetic. So in summary, frozen shoulder is a relatively common condition, and it can be rather painful. If you feel that you're suffering from frozen shoulder and you're not getting any relief from your problem, please feel free to get in touch with your GP and get a referral to see us at One Ashford.